In a PA view, what structure is seen to compress esophagus? A. Arch of aorta. B. Right cruce diaphragm. C. Trachea. Option B is the right answer. How's the potency of inhalational anesthetics checked? A. Vapor pressure. B. Lipid solubility. C. Water solubility. D. Minimum alveolar saturation. Option B is the right answer. A football player has got injury on lateral aspect of his right knee with a fracture of the neck of fibula. The artery most likely damaged is A. Plantar artery. B. Peroneal artery. C. Popliteal artery. D. Anterior tibial artery. Option D is the right answer. A 60-year-old male with anterior chest pain and dyspnea. ECG and cardiac enzymes normal. Chest X-ray shows cartilaginous and amphiarthrosis. The structure is A. Xiphisternum. B. Sternocostal. C. Costochondral. Option C is the right answer. There is greatest chance of pneumothorax formation while inserting CVP via which route? A. Carotid artery. B. Internal jugular. C. External jugular. D. Right subclavian. Option D is the right answer. Cushing triad consists of bradycardia. Increase ICP. In A. Hypotension. B. Hypertension. C. Arrhythmias. D. Regular respiration. Option B is the right answer. A 40-year-old woman has difficulty in swallowing, and it is more difficult to use the keyboard of her computer because she finds it hard to move her fingers, though the joints are not painful. She has lost the facial wrinkles that she was beginning to develop in middle age. A skin biopsy is performed and shows extensive dermal fibrosis but almost no inflammatory cell infiltrates. These findings are most typical of A. Amyloidosis. B. Crest syndrome. C. Dermatomyositis. D. Mixed connective tissue disorder. Option B is the right answer. Pus when accumulates in boils or abscesses is mainly composed of A. Exudate. B. Monocyte. C. Dead bacteria. D. Dead neutrophils. Option D is the right answer. Fat pad in the upper eyelid is anterior to A. Orbital septum. B. Superior rectus. C. Orbicularis muscle. D. Levator aponeurosis. Option D is the right answer. A young girl presented with fatigue and weight loss. On examination, she had ascites, right-sided pleural effusion, and an abdominopelvic mass. Ultrasound confirmed a mass in ovary. Which marker is likely to be raised? A. CA-125. B. CA-19-9. C. Serum CEA. D. Serum estrogen. Option A is the right answer. A 5-year-old boy presents with repeated episodes of epistaxis and gum bleeding. Blood show HB10, platelets normal. Bleeding time more than 20 minutes, APTT 28. What is the diagnosis? A. Von Willebrand factor. B. Hemophilia A. C. Factor 7 deficiency. D. Christmas disease. Option A is the right answer. Hydrocele is a fluid accumulation within one of the following structures. A. Round ligament. B. Scrotal ligament. C. Tunica vaginalis. D. Gubernaculum testis. Option C is the right answer. A known obese myxedema woman presents with weakness of right hand for the past few days. On examination, there is weakness in thenar eminence and impaired sensation in the thumb, index, middle, and medial side of the ring finger. Diagnosis is A. Cubital tunnel syndrome. B. Carpal tunnel syndrome. C. Pancoast tumor. D. Cervical rib. Option B is the right answer. Biopsy of an alcoholic patient liver shows presence of Mallory bodies. What is the composition? A. Desmin. B. Hyaline. C. Collagen fibers. D. Intermediate filament. Option D is the right answer. Mechanism of tumor metastasis is I. Downregulation of E-cadherin. B. Basement breaching. C. Breakage of cells. D. Migration of tumor cells. Option A is the right answer. A 4-year boy presents with periorbital edema, generalized edema. Mechanism of edema is A. Salt retention. B. Hypoalbuminemia with salt retention. C. Hypoalbuminemia. D. Lymphatic obstruction. Option B is the right answer. A woman has hirsutism, hyperglycemia, obesity, muscle wasting, and increased levels of ACTH. The most likely cause of her symptoms is A. Pheochromocytoma. B. Primary adrenocortical deficiency. C. Primary overproduction of ACTH. D. Hypophysectomy. Option C is the right answer. Patient had an RTA injury at the level of T10. On examination, he was pale and hypotensive. Organ likely damaged. A. Rectum. B. Spleen. C. Stomach. D. Heart. Option B is the right answer. In acute tubular necrosis, which part of nephron is most likely affected? A. PCT. B. DCD. C. Collecting duct. D. Loop of Henle. Option A is the right answer. A young female with a catching body line presents herself to the gynecologist with a complaint of having no menstruation since puberty. On examination, pubic hair and breast are normal. Vagina is short and uterus is not palpable. On buccal smear, sex chromatin bar body is negative. On further examination, testes were palpable and growing. The most likely condition is A. 46XXY, B. Deranged androgens, C. Klinefelter syndrome, D. Testicular feminization syndrome. Option D is the right answer. Characteristic feature of hemophilia is A. Hemarthrosis, B. Epistaxis, C. Purpura, D. Ecchymosis. Option A is the right answer. Which of the following is associated with prolonged use of corticosteroids? A. Worsens diabetes mellitus, B. Increase osteoblastic activity, C. Cholestatic jaundice, D. Hypoglycemia. Option A is the right answer. A 12-year-old boy has been coming to emergency with frequent episodes of pain in abdomen, chest, and joints. He is usually febrile and has jaundice at the time of attacks. Spleen mildly enlarged. Hemoglobin 6,8 GDL and red count raised. The cause is A. Hemoglobin C disease, B. HbE disease, C. HbSC disease, D. HbSS disease. Option D is the right answer. During examination, deviation of the protruded tongue to left indicates damage to the A. Left genoglossus, B. Right genoglossus, C. Left hypoglossal nerve, D. Right hypoglossal nerve. Option C is the right answer. Which of the following is a cause of edema in known ischemic heart disease, hypertension, patient with heart failure? A. Increase hypertension, B. Decrease oncotic pressure, C. Increase hydrostatic pressure, D. Increase capillary permeability. Option C is the right answer.
Thank you for watching. If you enjoyed this content, please consider like, subscribe, and sharing it with your friends. Your support means a lot to us.